Hello, it's Dr. Jo. I'm going to talk about menopause because lots of people ask me, what is menopause? Well, it's a simple question, and a simple answer is it's when your periods stop for 12 months. That happens on average at the age of 51 in this country. But it's far more complex than that, as I'm sure most of you out there will say. But I would actually say menopause isn't complicated if you listen long enough, and that's the crux. It's about listening to yourself, listening to your body, and enabling our clinicians to have enough time to listen to. So menopause, where does that term come from? It comes from the mens, which is monthly, Greek word, and pausis, which is stopping. 12 months need to have elapsed before you are menopausal, as I've already said. But the perimenopause can go on for up to 10 years before that. So perimenopause for a lot of people can start at 41. And if you think about it, that's quite a long time. And there isn't necessarily any change in your periods. But what's even more interesting is that 1 in 100 women of the age of 40 will be menopausal. So that means that 1 in 100 30-year-olds are starting their perimenopause symptoms. And often psychological symptoms can start up to 2 to 3 years before there is a change in periods. Anxiety, depression, word loss, all these symptoms can start when there's no change in periods, and often it is misdiagnosed as anxiety or depression. So that's why we need to think very carefully about what's going on with our bodies. What's also key to think about is, how old was your mum when she had the menopause? Did you have postnatal depression or premenstrual syndrome? So the periods can be irregular, and increasingly so. But let's just look back at those psychological symptoms. They're really difficult to cope with, because if you're in the middle of presenting something at work and you're 35 and all of a sudden you forget a word, what is that about? The perimenopausal woman finds it difficult to find her car in a supermarket car park, walking around with her car key looking for the key that is flashing at her, walking upstairs forgetting why she's gone upstairs. What's fine now isn't fine tomorrow. Okay? And that's pretty tough for people that live with you and for you as well, because the symptoms can be so severe, and they can be severe enough for you to make drastic decisions and take sometimes drastic action, which is why it is so important to get this message across.